Hello, everybody. This is Julie and Dr. Cox. Thanks for joining us this afternoon for this Wednesday webinar, Spinal Nutrition. We thought it'd be nice and short, but I think he's got a whole bunch of stuff for you that you'll really enjoy. So be sure to download your handout. It's down in your control panel under handouts. So there's one file there you can download at any time throughout today. If you have any questions, please type them into your chat or question panel, and I will bring those up as we have time today. And anyway, enjoy this. It'll be a quick one relative to some of the others, and then you'll get back to treating patients. So enjoy. Go ahead, Dr. Cox.
Whether we're looking at congenital stenosis to end-of-life degenerative spinal stenosis, we need all of the armamentarium we can muster to meet this epidemic problem as a profession. I would like to share with you today all referenced material on one aspect of treating spine pathology, that is, its nutrition. Some of the references I only put in yesterday. Yesterday I had 898 papers from PubMed search. Some of them are in this webinar today so that you have the most current research to look at the care of the spine from a nutritional standpoint, which adds another phalanx to our clinical competence. We're going to be talking about chondroitin sulfate and B vitamins in the prevention of cartilage degeneration and hopefully even regeneration changes. We look at some of these papers, and this one came out in 2019 in Aging Clinical Research. And you know, this is a big part of anti-aging literature today, but this paper states that nutritional changes can slow down the progression of degenerative spinal disc disease. They're talking about glucosamine and chondroitin sulfate, the potential aggregate-based proteoglycan therapies for disc regeneration. Yes, you can get these papers. Everything I give you will have a reference with it. Regeneration of white fibrocartilage, whether it be the medial meniscus of the disc or the intervertebral white fibrocartilage of the spine, is interesting to us today. The Russians are leading research in this field. Here's one from 2019. I'll show you one that I got yesterday. But they are using chondroitin sulfate in chronic back pain to reduce both the severity of the pain and to reduce anti-inflammatory medications to reduce M1 type of cytokines. We look at this one. This just came out this year in June, pointing out that the addition of chondroitin sulfate proteoglycan has therapeutic potential for intervertebral disc degeneration by stimulating anabolism of bovine cells. So that you could say from this paper that the anabolic effect of chondroitin sulfate during the early culture period with changes in hydrostatic pressure have the ability to stimulate anabolism of nuclear cells. Now, hydrostatic pressures certainly are changed, and I will refer you back to the 1997 2000 paper on the study that we did on intervertebral disc degeneration and the effects of some of these hydrostatic pressure changes. Even the first paper from 1994 to 97, in which we showed what? The intradiscal pressure drops when we do this form of Cox distraction manipulation. And so what is the effect of that on stimulating circulation into the disc? Here's another Russian paper. The glucosamine sulfate stops the destruction of cartilage, reduces symptoms of osteoarthritis. These types of papers certainly cause reflection on our part in using them in treating back pain. Incidentally, in Russia, they call these chondroprotector drugs, and this one is named Sustgard Atro. That's what they call chondroitin sulfate and glucosamine sulfate used for disc regeneration. Another Russian journal from 2020 reducing M1 cytokine inflammatory chemicals. Important for you and I because especially in non-contained discs and even in high intensity zones of annular degeneration, we have the formation of these cytokine inflammatory chemicals. And they're named here, certainly interleukin 1B, interleukin 6, and of course the biggie, tumor necrosis factor alpha. Here's a paper out of Spine in August of this year about the use of injectable hyaluronic acid. But in this paper, the interesting thing is that hyaluronic acid hydrogel downregulates interleukin 6 expression, and this is one of the pro-inflammatory cytokines that causes disc degeneration, as well as what? Chemical inflammation of the nerve root and especially the dorsal root ganglion. This paper came out last month in Bone Reproduction about the fact that when we use the green lip mussel, Perna canaliculus, which is the highest source of chondroitin sulfate that I read about, that it actually inhibits osteoclast action, leading to a crucial part in such tissue diseases as osteoporosis and osteoarthritis. So I would urge you to look at these papers, consider them for your own clinical help of your patients, as I have since 1966, and the benefits of treating osteoarthritis, and as this paper points out, osteoporosis, which we both know the problems we deal with today. This paper from 19, the main factor in degeneration is the loss of proteoglycan. What are proteoglycans? They're mucopolysaccharide changes within the disc made up of glycosaminoglycan, which is 4 things: chondroitin 4 sulfate, chondroitin 6 sulfate, carotene sulfate, and hyaluronic acid. So the main factor is the loss of these proteoglycans from white fibrocartilage, which is the intervertebral disc. Our treatment with nutrition is to retard disc degeneration, stimulate disc regeneration. It is known that impaired nutrition leads to disc degeneration, and there is a need for improved nutrition. Shirazi Adel, who was a finite element analysis developer, says that disc nutrient concentrations can fall to subliminal degrees, allowing apoptosis, selective cell death, leading to disc degeneration. Pierce wrote that low proteoglycans are not just seen in a disc that you and I see degenerated, but is actually a systemic disease occurring throughout the entire disc of the spine. This guru wrote this paper in 2014 in Spine Journal that poor nutritional supply has the long-term effect of bringing on disc degeneration. Schleich says that the glycosaminoglycan, which we just said what that is, it's 4 elements. The glycan, the content of the nucleus and annulus show differences between different grades of degeneration and normal disc. Another paper from the Russian journals, and that is a peer-reviewed Russian journal that you're reading at the top. But chondroitin sulfate is a chondral protector, contributes to regeneration. This is this paper. It's there for you to ferret out on your own to check the source. But chondral protectors are biological agents that contribute to the regeneration of cartilage surfaces, joint capsule, metabolism of articular cartilage. Progressive loss of hyaline cartilage, which is the end plate of the disc, and decrease of chondroitin sulfate are seen in osteoarthritis. Deng points out in this paper, the depletion of glycosaminoglycan in degenerative lumbar disc correlates significantly with discal degeneration. And so when you look at this, and this is the work of Fearman, the 5 classifications of disc degeneration, and I would urge you to, on page 130 of this textbook, to learn Fearman, because when I read MRs, when I read other people's MRs, they are using the Fearman classification, everywhere from normal to grade 5 degeneration, which is what you and I see these things every day in clinical practice. So when we correlate the degeneration we see, and we think about the papers we've just discussed, what is the chondroitin sulfate, glucosamine sulfate? The minerals found in white fibrocartilage. Certainly we know from science that they are depleted and worsened with the progression of disc degeneration. Learn Fearman's classification, perhaps. And then there was Geyring and Heat. Remember these papers? Beautiful things about disc distraction shows evidence of regenerative potential in the degenerated discs as evaluated by protein expression on MRI imaging. 28 days of compression caused disc degeneration, 28 days of distraction caused regeneration. When we look back at the papers we've studied, the change in hydrostatic pressure as we furnish glycosaminoglycan, that is chondroitin and glucosamine sulfate, as we change hydrostatic pressure, what is the effect of the imbibition of fluids? Remember the work of Beati et al. Showed that people who had immediate response and relief from spinal manipulation showed via diffuse imaging that there was an increase in anastrophy and apparent diffusion coefficient, that is fluids going from the vertebral body through the end plate into the nucleus. So you begin to sense, and admittedly more research must be done, and I must get that done, that the change in hydrostatic pressure while furnishing the people with chondroitin pernicanalicus may well have benefits in disc degeneration. Well, Welburn wrote in the Journal of Arthritis Research, pernicanalicus is the most potent source of chondroitin sulfate known. It is from the source of pernicanalicus, which is a green lip mussel from New Zealand, grown in the ocean on cables that hang into the ocean. And it is harvested off of these boy lice that has definite anti-inflammatory properties. And these studies, like by Daniels, in this, you can go to this website and read it. 2 new studies report the benefits of the green lip mussel lipid fraction. Not only is it at our Australia's Royal Melbourne Institute of Technology, not only is it used in treating degenerative change, but the chronic inflammation linked to other conditions, heart disease, we'll talk about that more, osteoporosis, cognitive decline leading to Alzheimer's and type 2 diabetes. The attenuation of interleukin 1B by the use of glucosamine taken with meloxicam is a powerful treatment for osteoarthritis. Cantor wrote, and I want to point out to you that when you give these, and all of these references, we have put into a flyer here, 82 of them. You can look these up yourself. How about this one? It's in here for you. Evidence emerged to suggest that glucosamine and chondroitin sulfate have been associated with reduced risk of colorectal cancer. This paper by Cantor in Cancer Causes Control, person reporting the use of glucosamine and chondroitin 4 days a week for 3+ years, had a non-statistically significant 45% lower cancer risk than non-users. Inflammation plays an important role in lung cancer. Saudi wrote, any use of glucosamine and chondroitin, which have anti-inflammatory properties over the previous 10 years, was associated with significantly lower lung cancer risk. Again, doctor, please look them up, read the papers. I would never present something to you unless there is some peer-reviewed journal support for it being published. This paper by Bell et al. From the European Journal of Epidemiology, the current use of glucosamine is associated with a significant decreased risk of death from cancer and the large risk reduction for death from respiratory disease. After an average of 7 years, people who took glucosamine had an 18% lower risk of coronary heart disease and a 15% lower risk of any cardiovascular event compared to those who didn't take it. Contra, the use of glucosamine and chondroitin lowers the hypersensitive CRP and prostaglandin E2 levels in the blood. Both of these need to be converted into inert amino acids to lower the C-reactive inflammatory protein in the serum. Oral chondroitin sulfate is a valuable, safe, symptomatic treatment for osteoarthritis. So with all this statistics, I lose sleep over this, thinking about it. When I first read these books, and you can get these if you want, they're called The Biology of the Invertebrate Disc, Volume 1, Volume 2, written by Cole Ghosh and Taylor at the Royal Shore Infirmary Hospital in Queensland, Australia. They were writing on their beagle dog research of degenerating discs, giving them nutrients, chondroitin sulfate, to stop degeneration. So these are the texts that you might want to read as well. Having read them, I got so excited about this that I created a formula in 1966. Now, doctor, you go back to 1966, unless you were, really driven in the research, you never even heard of this. But I did, and I started formulating Pernicalliculus from New Zealand. And the goal of this formula, and I call it Discap Plus. This is what I use, I give to all of our patients with discal degeneration. And even since disc degeneration starts when? In the teenage years of life, thinking that more than half of teenagers in this country have back pain and show discal degeneration. Starting at a very young age, but certainly isn't happening. Should be taking Discat Enhanced. As an anti-inflammatory, it's re-engineered to gain the current research. I changed this thing. I had to. I couldn't get this in the 60s and the 70s. So to get the best benefits of spine and joint pain, we determined Pernicalliculus as the source. We continue the reformulation as research occurs. When I use this to share with you, the formulation of Discat will be 1 serving is 2 capsules, contains 100% Pernicalliculus, 400 milligrams per serving, glucosamine 500 per serving. The dosage, first 3 months. I suggest, and almost all my patients do, take this for the first 3 months at 3 capsules AM and PM. After 3 months, reduce it to 1 AM and 1 PM. This is it. You can study the formulation. You can compare it to your erudite study and decide with all the references if this is something worthy of helping your patients. B vitamins. The final link in controlling anti-inflammatory chemicals through homocysteine control, methylation, and to lower hypersensitivity C-reactive protein and myelination of nerves are B vitamins. Let's look at the literature for your consideration. You can read these papers. Here's one about current aging this month. This paper just came out. I'm sure some of you read it. Maybe even the reason you're studying with me today is you want to know more about this. The adequate intake and supplementation of B vitamins, in particular folic acid, can play a protective role in bone health. B vitamins deficiency have negative consequences on bone. This paper is showing that when you lower hyperhomocystinemia and correct low folate blood levels, that you are actually in elderly patients with osteopenia and osteoporosis, you are reversing these changes. As we get older, do we have post-endocrinopathies? Do we have softening of bone? Do we see more and more compression fractures? Do we not see more camptocormia in our patients? Is the best time to treat that way before it occurs? Ideally, but you and I are called to treat it once it's there. B vitamins chondroitin sulfate, glucosamine sulfate are certainly a strong need in treating these bone deficiencies. This just came out in 2000. Folate and B12 deficiency impair memory function. And also, as we saw before with the work of Danielle, Discat and chondroitin sulfate can repair and improve memory. This pain came out in this paper in 2020. B vitamin treatment can greatly suppress chronic diabetic nerve pain. This study at Purdue showed that in women with lower serum B12, the red blood cell folate, and micronutrient deficiencies, they showed that in women who took B vitamins, that they could actually reverse hyperhomocysteinemia and lower the risk of lumbar osteoporosis. This study showed that plasma homocysteine, which is increased in later life after menopause, can be a factor in cardiovascular disease and osteoporosis. Folic can reduce plasma homocysteine in postmenopausal women. And we certainly are well aware of the endocrine changes in postmenopausal year. The body needs sufficient amounts of dietary B12 and folate to do this. Without enough B12 and folate, the recycling process causes homocysteinemia. Hyperhomocysteinemia has been linked to numerous vascular problems. Big one, deep vein thrombosis. People who ride on airplanes, sit a lot. Certainly, you want to lower their homocysteine levels, but also in coronary artery disease and stroke. We measure the levels of B12 in the blood, not just by B12, but the more accurate test is methylmalonic acid. In the B12 deficiency, methylmalonic acid elevates in the blood and is felt to be more sensitive in determining B12 levels than is B12 test itself. I want you to know subacute combined degeneration of the spinal cord. This is the edema that can occur in the spinal cord, especially cervical spine, in myelopathic change due to cervical spine degenerative spondylosis. There's no way that as clinicians, many people come to us with neck problems, that we can escape some of these edematous changes. So interesting is subacute degeneration of the spinal cord that in our clinic, people who have radicular upper extremity pain, degenerative disc disease, chronic pain, degenerative arthroses of the cervical spine, I put them on B12. You can do that with giving people a formula. I have a formula that I made because I want it to be right. Give them that, or you can even supplement with 5,000 micrograms of B12 sublingual a day. So important, so helpful are papers like the one you see before you on treating the posterior cord syndrome brought about by compression, ischemic hypoxia of cervical nerve roots due to degenerative spondylosis. Bailey writes here in current osteoporosis report that vitamin D, B vitamins, folate, B12, and B6 are emerging dietary factors relating to bone health. They reduce fracture risk. Pyridoxine, B6, helps maintain normal nerve function, keep blood sugar in check, produce antibodies and hemoglobin. Taking B6 can reduce high blood levels of homocysteine, a substance thought to contribute to heart disease. Long-term multivitamin mineral use tied to women's health. In this report came out in 2015 that a new analysis of deaths from heart disease in a 20-year period find that women who took multivitamin mineral supplements for 3 years or more were significantly less likely to die. They also urged that this was not true in men. Porter wrote here in Nutrients that deficiency of B vitamins alone or in combination, including giving people methylene tetrahydrofolate reductase, Giving them that leads to better cognition, lowers cardiovascular disease, and osteoporosis. It is the methylation. When you give people vitamin B12, you convert homocysteine into methionine, which makes a inflammatory chemical and a healthy amino acid. This paper came out in 2016 about folic acid, and I just mentioned this to you because so many women who become pregnant by accident never on prenatals. Remember that the closing of the spinal cord, anencephaly and spina bifida are taken care of within the first month of pregnancy, within the first 28 days actually. So women who are not taking B vitamins, are deficient in folic acid, folate, they will have these closure, spina bifida problems and anencephaly that we don't have to have, but that's why we use prenatals. So to decrease the risk of NSAID drugs, B vitamins are used to lower the use of NSAID drugs. This is another Russian study. Behringer writes that infectious disease is lowered by 31% by taking a multi-mineral vitamin supplement. This was out of a Lancet journal, 1 vitamin tablet a day for 30 days, cut in half the death rate, days of hospital stay, and complications in people who had femoral fracture surgery. Hospital charges for birth defects, low birth weight, premature births, and coronary heart disease can be cut by 50% in this journal from the Western Journal of Medicine by the daily use of B9, zinc, and vitamin E. Deficiency of B vitamins has been linked to neurocognitive disease, mitochondrial dysfunction, immune dysfunction, and inflammatory conditions. Take mitochondrial dysfunction. In the mitochondria, the conversion of ADP to ATP, it requires oxygenation. And at the end of that process, you have the buildup of ununited oxygen called free radicals that can also lead to DNA changes and disease. Again, a big reason to use B vitamins. The role, this paper just came out April of this year, but the role of B vitamins, thiamine, pyridoxine, 12, in back and other conditions have an anti-inflammatory, pain relieving, neuroprotective, neuromodular action on the descending pain system of back pain. For no other reason than that, for me, I encourage all of my patients to take B vitamins. They are, I tell them, as nature's tranquilizer. They have very natural relaxation properties. This paper again came out August of this year. Folic acid can effectively treat cardiovascular stenosis, prevent cardiovascular disease. Then patients treat with heart disease with antithrombotic and anticoagulant drugs. The journal, this paper I just put in for you, the journal Cachexia and Sarcopenia Muscle, the nutritional status and skeletal muscle status of people with head and neck cancer. Yes, read the paper. It shows that in people with head and neck cancer, the improvement in skeletal disease progression and improved outcome is far better in patients who take nutritional support. This is not unknown. This is true of many diseases, as you know, and we can do a literature search to prove that. But combining this to reduce sarcopenia. Sarcopenia is the muscle loss in sarcomeres that takes place in chronic disease. So we use this one on. I've had to do these things because I wasn't satisfied with things I got, but this is one I make called Formula 1. Again, give the patient something to read with all the references, why they take it. This has 2 capsules a day. It gives vitamins, including vitamin F, G, H, and P, lowers fat, lipids, digestive enzymes to ensure absorption, has minerals, trace minerals, amino acids, the ability to lower homocysteine, and special herbs for immune support, as well as antioxidants. So the evidence-based complementary alternative medicine just came out August here. The natural products. What are the natural products today used in aiding nucleus pulposus cells and intervertebral disc degeneration? Perhaps this is one paper you would want to ferret out for your own clinic. Inflammation, oxidative stress, mitochondrial dysfunction, the buildup of reactive oxygen status, abnormal mechanical load, telomere shortening, which is the big measurement of aging, DNA damage, nutritional deprivation, contribute to intervertebral disc degeneration. This paper just came out. You may not have it yet. Here's how you get it. But these inflammatory factors, the ones that we talk about, these are macrophage type 1 pro-inflammatory, tumor necrosis factor alpha, interleukin 1, 6, 8, 2. Here's macrophage type 2, anti-inflammatory, interleukin 10 and 5. These promote extracellular matrix degeneration, autophagy, which is the absorption of waste product, reduce aging, and intervertebral disc cell selective cell death. So weakened oxidative capacity in the intervertebral disc causes reactive oxidative stress, which accelerates nuclear cell death and degeneration. So a reduction in nutrient supply leads to a diminished oxygen level. Remember this, if you look back at some of the early work of Nachemson, the intervertebral disc requires high amounts of glucose and oxygen for its metabolism. Reduced nutrient supply leads to diminished oxygen levels, elevates lactic acid concentration. These are the biodegradation products of disc degeneration. Changes pH, affects cell function, alters extracellular matrix synthesis. Cells stop producing proteoglycans. That is, we lose the presence of glycosaminoglycan, which is the chemical in the nucleus of the disc that absorbs fluids to 9 times its own volume, thus giving the intervertebral disc the property of turgor, the hydrostatic pressure, the ability to withstand or fight against gravity as two-legged bipeds. One last thing I share with you about disc degeneration is curcumin. We have a formula of curcumin, which is an anti-inflammatory, antioxidant. I give all people with acute disc, especially those who have non-contained nuclear leaks into the vertebral and the osteoligamentous canal, we give them curcumin. This disc and joint relief. It's curcumin. Yes, it has quercetin in it as well, which is a natural occurring phenolic. And remember, basically, that the natural pharmacological products to stop disc degeneration are phenolics, flavonoids, alkaloids, terpenoids, saponins, and quinones. They regulate oxidative stress, inflammation, apoptosis, and matrix metabolism. Therefore, we use curcumin and quercetin. I give them to people with acute disc, especially with radicular component, nuclear leaks. I use them anymore on all people with back pain because it is our ability to reduce the use of opioids and everything from NSAIDs through opioids. So we also use calcium and vitamin D3. And to end this, I'd like to show you the shelf in my bathroom. This is what I take. This 81-year-old guy takes these things every day. Coenzyme Q10, conjugated lanolinic acid. This is the curcumin formula at 2,000 milligram a day. This is Discap Plus, which I shared with you. I take these 2 in the morning and 2 at night at 2,000 milligrams. Calcium citrate, 1 a day. Formula 1, the B vitamins. B12 sublingual at 5,000 micrograms. Folic acid here at 400 micrograms twice a week. D3, I take 1 of these every other day. and vitamin C. Those are the things that I take, all based, at least to the best of my ability, on the literature I've just shared with you. I realize that some chiropractors don't use any nutrition. I don't understand that, but that's your prerogative. The more you learn, and the more you can give a patient succinct formulas without them having to take too many things, the better our clinical results. I think, I don't know how many minutes that was, but
About 36.
36, I went longer, but at least you have the papers. I want to thank you. You can look these papers up. I hope that you will critique me, question me, or say, you know, Jim, I learned something. Boy, I mean, I'm reading these papers. I mean, 897 of them yesterday. It took me over 4 hours to read all those yesterday. Well, thank you for studying with me. And one last thing that I'd share with you is that when you give people these formulas, give them these little books. One's on neck, upper back, shoulder, and arm pain. One's on low back and leg pain. These describe in layman's terms, and I prepared them for my own patients. They describe all the conditions that you and I see. Everything from disc degeneration, herniated disc, spinal stenosis, fitting the pregnant woman. It covers everything from what our technique is, the nutrition, the home exercises, and understanding that it will take 3 months to heal a disc rupture. Don't expect them to be gone in 1 week. And it tells people why they take the formulas that we just talked about. And as we get people to cooperate with us, and we change their ergonomics, their daily lifestyles, and the nutrition, it aids us in getting the best clinical outcomes. Thank you for studying with me.
Thank you for joining us today. And hopefully you downloaded your handouts. If you missed it, just give me an email later and I'll get them to you. But I don't see any questions up right now, but if anybody needs, something just popped in.
Good.
Let's see here. Nope, a good thank you. So thank you.
Thank you.
All right, go have a great afternoon. I know you'll see some patients who can benefit from your knowledge from this webinar. So have a good afternoon.